My name is Linda Bird. I'm the Director of Programs and Services for the Alzheimer's Society of Nova Scotia. So during COVID crisis, we're not offering face-to-face programming. Instead, we're trying to stay connected to you through the Zoom platform and programs such as this. So please, throughout the presentation, feel free to ask questions using the private confidential chat box that's addressed to the Alzheimer's Society of Nova Scotia host. If you don't see it, use the mouse to hover near the bottom, and there should be a chat in the middle of your screen. You can click on that, and it should pop up for you. Remember to press enter so that the question comes to us. For best viewing, we suggest you use the speaker's view, which you can see in the top right-hand corner of your screen. If you see the speaker's view button, click on it, and it should make the screen big, and whoever's presenting will be on the screen. So today, our audience includes people living with dementia, people caring for someone with dementia, and people who want to learn more. As Claire said, it's a reminder that this is being recorded, and your microphones and cameras are turned off, so your faces and voices aren't part of this recording. So our topic today is the Maritime Brain Tissue Bank, what you need to know. And we get a lot of questions about brain donation. So today's session will be a 20 to 30-minute presentation followed by question and answers. So before I turn it over to our guest speaker, Dr. Sultan Darvish, I'd just like to tell you a brief things about him. I could go on, but just the top highlights are that he is a professor at the Division of Neurology, the Department of Medicine, Department of Medical Neuroscience. His research topics include Alzheimer's disease, diagnosis and therapeutic agents for dementia. He has numerous degrees, including his PhD from UNB, his postdoctorate fellowship from the University of New Brunswick, his MD from Dalhousie University, his FRCPC from Dalhousie University, and his fellowship from Baycrest Center for Geriatric Care, University of Toronto. He has numerous publications, honors, degrees, special, all kinds of things. But what I'm going to highlight is since 1999, he has been on our research advisory committee for the Alzheimer Nova Scotia. We've had the pleasure of having him present at our conference and our awareness breakfast. And it's always a pleasure to have him. And he's here today in his role as the director of the Maritime Brain Tissue Bank. So I'm going to pass it over to you, Sultan.
That's great. Thank you very much, Linda. This is great. The Maritime Brain Tissue Bank is so very dear to me. When I started out, or before I started here on staff, I was interested in Alzheimer research, and I realized that there is no way that we can get human brain tissues to do research. And it is absolutely important in order to understand human diseases to examine human tissues, right? Because there is no satisfactory animal model of any disease that we know, let alone Alzheimer's disease. So in 1993, Ken Rockwood and I walked over to Alzheimer's Society of Nova Scotia and talked to the folks there at that time, and we said we would like to start a brain bank, and they were absolutely supportive. And so we have been, and I will tell you later on, we've been doing this, collecting brain tissues since then. So it all started with a conversation with Alzheimer's Society of Nova Scotia, and we are very grateful for that. So I will use Alzheimer's disease as an example of how research was started, and then I'll go into a little bit more detail about the brain tissue bank and the process, and then I will use one example of how a brain bank and human brain tissues can be helpful in research, because in order for us to understand what causes Alzheimer's disease and to find a cure for that, we need to be able to examine human brain tissues. So if you look here, this is Alzheimer, and this is the first lady that he was admitted to the hospital at the bottom in Frankfurt. And this lady was in her 50s, and she had behavioral and cognitive problems. And Alzheimer admitted her there. He looked after her and all that. And then he left for Munich from Frankfurt, and that is relevant. because when he went to Munich, there was a lot of research being done by this particular group. And there, people were doing research into brain tissues, how to preserve brain, how to stain brain tissues and examine them, etc. Right? And so he found himself in an environment where a lot of research on brain was being done. And so when this lady died in Frankfurt, he requested that the brain be sent to him for examination using this new techniques. And so when he examined the brain, he saw all these plaques and tangles that that we now we know that are characteristic of Alzheimer's disease, and we'll come to that. The point here is that Alzheimer was able to see the patient, follow the patient, and then was able to examine the brain tissues. And so what we understand as Alzheimer's disease today is when there is a clinical symptoms of cognitive impairment, and that when we look at the brain at the autopsy, we see plaques and tangles, then that is what we call Alzheimer's disease. You see, those are plaques and tangles. There is this amyloid plaque, and this is tangles. Now I'll come back a little bit. I get asked this question a lot. Dementia. What is dementia, and how does that relate to Alzheimer's disease? So dementia is a generic term, and dementia just reflects that there is somebody who was normal and now has developed cognitive problems, memory problems, and behavioral problems that interfere with activities of daily living. That is the key thing: cognitive impairment that interfere with the activities of daily living. That is dementia. Alzheimer's disease is one of those dementia syndromes. It happens to be a more common one, but there's dementia with Lewy bodies, there's frontal lobe dementia, etc., vascular dementia. So when there is dementia during life, that at autopsy, we see plaques and tangles, that is what we understand as Alzheimer's disease. And the problem here is that we need to, in order to make a definitive diagnosis of Alzheimer's disease, we need dementia syndrome during life, but we need to look at the autopsy. You know, we can be 80% sure, 90, 95% sure that it's Alzheimer's disease, but we are never 100% sure that it's Alzheimer's disease. We need to look at the brain to see these plaques and tangles. And that is the important thing. And as I said earlier on, it is absolutely imperative if we want to look at, we want to do research and find out why people get Alzheimer's disease. What causes Alzheimer's? You know, people think that these amyloid plaques and these tangles cause Alzheimer's disease. And the issue is, you know, we are not sure what causes. We find this in the brain, but is it cause or not is $1 million question that has not been answered. And that's why we, as I said, we started the Maritime Brain Tissue Bank, and we started that in 1993 with the help of Alzheimer's Society, and then subsequently with the help of Dalhousie Medical Research Foundation. A few years ago, Dalhousie Medical Research Foundation, every year they have Mali Appeal. Some of you may be familiar with that. And every year they rotate between various disease processes and establishments. So this time it was for the brain bank specifically, and that was great, right? So Alzheimer's Society of Nova Scotia has been giving us not only support and education to public and promote the research program that we are interested in, but they also contribute financially to this, as does Dalhousie Medical Research Foundation. So as I said, it was established in 1993, and what is the purpose of this? It was to collect brain tissues so that we can make them available to people who are interested in doing research in brain diseases like dementia, Alzheimer's disease, and other things. And as I will show you a map, we have collected quite a few brains, and we send them to many places around the world. So the purpose is to do that, and the mission is to facilitate discovery for cause and cure for Alzheimer's disease and many other neurodegenerative disorders. And this is what our mission is, to find a cure. So when we started this brain bank many years ago, I had the idea that, we'll collect brain tissues for our own research because that's what we wanted to do. And then I realized that, that's no good. These brain tissues are everybody's brain tissues. They belong to everybody, right? And so I decided that we will send these brain tissues to anybody in the world who is doing research, because, I'm sure that there is a clever person somewhere out there in the world who will be able to find a cause and cure. So we send these brain tissues around the world. So just to give you a flavor of what we've been able to achieve so far. In 1993, there was only one brain in the lab that I was working in. I think it was one or so. And then we went to Alzheimer's Society, and the brain bank was formed, and you can see we started getting a lot of brains, 30 brains and more. And as you go, it fluctuates from year to year. But nonetheless, so far, we have been able to collect 1,300 brains. We don't have 1,300 brains right now because we send them everywhere around the world, but we have had a total of 1,300. And this is an amazing the thing that has happened, and people ask me. I was being interviewed about the brain bank during Mali Appeal a few years ago. CBC came in the global television, to promote this campaign, and they were asking me, how come it is that you have such success here in Halifax? Well, the reason we have success is because I said, when there is goodwill, good things happen, and there is goodwill here, and you can see that goodwill right in front of you from this graph and the number of brain tissues that we have had. So if you look at the brain tissues that we have had, the most common one, obviously, Alzheimer's Society has been promoting this. So most of the brain tissues that we have are Alzheimer brain tissues. But we have to remember, when we look at the brain, they can be mixed. There are a lot of people have not just one pathology, Alzheimer pathology, but they can have Alzheimer's disease, or they can have strokes, or they can have mixed pathology. The other thing is cognitively normal. The strength of a brain bank is based on how many normal brains we have, because we have to be able to compare what is normal from what is abnormal. But this is the flavor there of what sort of brain tissues that we have had, and multiple sclerosis, ALS, etc. And there are many others diagnoses we have. But most common one, obviously, is Alzheimer's and mixed dementia syndromes. And this is the map where, we have sent the brain tissues pretty much all across Canada. Major centers across Canada. There are 4 brain banks across Canada, and to the best of my knowledge, we, the Maritime Brain Tissue Bank, send them around the world, and also to other centers in Canada. We have sent them to the United States. We have sent them to Middle East, to Israel, and to Denmark and Sweden, and those are the places that we have sent these tissues. So once again, as I said, the diagnosis of Alzheimer's disease requires autopsy. And that is a problem, because if you are only 80-90% sure, then you need to do better than that, right? But these are the plaques and tangles. So one of the things that people have done, and this was a very, very important discovery. So as I said earlier on, in order to make a diagnosis of Alzheimer's disease, you need to have dementia syndrome. You need to have cognitive impairment that interferes with activities of daily living. Then that at autopsy, you see plaques and tangles. So it's very, very clever people said that if you have these plaques in there, if we make molecules that can go and specifically bind it to either the amyloid or to the tau in neurofibrillary tangles, and then we do a scan, would we be able to then do things during life and make the diagnosis during life? And as a matter of fact, very clever people did clever things, right? And so there are many labs that made these molecules that specifically bind to amyloid, and they are tagged with radioactive material that is PET friendly. So PET is one of these imaging modalities that people use. And so when you inject this molecule, one of these molecules, in a person with Alzheimer's disease, then you see all this red stuff where the amyloid is. When this molecule, radioactive molecule, goes and binds, and you do a PET scan, it lights up, and you see all the red stuff. and that means that there is amyloid in the brain. So when they made the other molecule that goes and binds to the neurofibrillary tangles, and you inject that in somebody with Alzheimer's disease, you see this red stuff. This red color is just one of these computer-generated things. The brain doesn't glow red, right? This is just the computer way to look at this. But when you see this, you see, oh yeah, there is amyloid there, right? There's a tau there, right? Neurofibrillary tangles. This is amyloid, so this is Alzheimer's disease. But there is a problem, and I'll show you the problem. If you see at the top is where somebody has had this injection of a molecule. They inject very small amounts, and they've injected this in the brain of somebody who was normal. And you don't see red stuff in this thing. You see blue, it means cold, there's nothing there. And then if you look at the bottom, the bottom one is somebody with Alzheimer's disease. So you see a lot of red and green and all that. That means that this patient has amyloid in the brain. And the conundrum is that there are some normal people, cognitively normal people, who don't have dementia. They don't have cognitive impairment. They don't have memory problems. But yet their amyloid is positive because they've got amyloid in their brain. We have no idea why that might be so. But there are about 20 to 30% of people, and this has been shown in many, many studies. The first study that showed this was the nun study. This was where the nuns in one of the monasteries in the United States, all these nuns were recruited, and they participated in this research for longitudinal research program where they examined everybody every year, and they did various scans and all that kind of stuff. And they found that when they did the autopsy, people who had dementia syndrome, many of them had Alzheimer's disease, but there were some people who had no dementia whatsoever. They also had plaques, and 20 to 30% of cognitively normal people have this. So when they went to FDA to get this approved, various companies to get this approved, this molecule approved for diagnosis of Alzheimer's disease, FDA said, no, you can't do this for Alzheimer's disease. You know, you can do this, but as an adjunct, you have to use clinical profile and all that. So this is not for making a diagnosis of Alzheimer's disease, but to help. So my group, and I'm going to use this as an example of how one can use the brain bank to determine, to make progress into new ways of looking at things. And so if this is a conundrum, that amyloid is there in 30% of people, are there some other molecules in the brains that we could use and target for Alzheimer's disease? And as a matter of fact, that there is, right? And so you can see, I showed you in the previous one that there are people who are normal, and when you look out for amyloid, there's no amyloid. That person has normal cognitive profile, no amyloid in the brain at the time of death. This patient was cognitively perfectly normal, and there's all kinds of amyloid. This is looking under the microscope, and this is Alzheimer's disease. And you can see this Alzheimer's disease and cognitively normal looks similar. So are there any other solutions? And this is one of the favorite slides I mentioned to you earlier on, that in order to be able to do research in human condition, you need to do human research. And this Alexander Pope's saying here resonates with me, that in order to study human being, you have to, in order to study mankind, you need to study human beings. And so that's what we have done, right? So we have looked at another molecule, not amyloid, but another molecule that we call BCHE. And you can see that this is the cortex. This is stained, and you're looking at the brain, and this is the gray matter. This is where brain cells are, and this is the white matter. And you can see that this particular enzyme, there is very little, if any, in the cortex. This is where the amyloid plaques and neurofibrillary tangles are. So this particular enzyme you see in white matter, but you don't see that in the cortex. But when you look at this under the microscope, and this is what we did, and we published this a couple of years ago, 3 years ago. At the top is the amyloid staining, and this is a normal person. This is amyloid staining in a person who is cognitively normal but has amyloid plaques, and this is Alzheimer's disease. When we stain for this particular enzyme BCHE in cognitively normal person in the cortex, in where the brain cells are, there's no staining. And when you look at the cognitively, no, this particular individual, and you stain for butyrylcholinesterase, there is very little of butyrylcholinesterase, and this is Alzheimer's disease. So you can see that this particular molecule is really different and can distinguish normal from cognitively normal with amyloid and from Alzheimer's disease. And that was something that was quite an eye-opening. And in fact, when we looked at this and we quantitated this, we showed that, you know, when you compare cognitively normal people with Alzheimer's disease, there's about twice amount of amyloid in Alzheimer's disease compared to cognitively normal with amyloid, but there's almost 10 times more of this particular enzyme in this. So this is a new understanding about what other things might be going on. And so we started to ask the question, if these people can image amyloid, they can image neurofibrillary tangles, tau, can we image this enzyme? And so I'm a chemist, and so we started making these molecules. And so I won't go into chemistry at all, because that's not the purpose of this. This is just to use this as an example of how one can make progress. And that we found that this particular enzyme is probably better marker for Alzheimer's disease than amyloid or tau. This is what we have seen. And so we made a lot of molecules, and we screened them for their ability to bind to this particular molecule, BCHE, and we tagged them with radioactive material so that we can either do a SPECT scan or a PET scan. And so before doing that, obviously we have to have an experimental model of this, right? But we have to ensure that experimental model has similar things in the brain as human Alzheimer's disease. So we have this model where, say, in this one is a normal animal model, and in the cortex, just like in human beings, there are no plaques. There's no BCHE in the cortex. But in this disease model, when you look at the cortex, just like in human Alzheimer's disease, we have a lot of BCHE. So we know that we can use this model to examine what is going on. So what we have done is looked at the brain tissues from the brain bank. We have found a new target. We have synthesized molecules to go and bind to that target. Now the question is, can we image that, right? And in order to image this animal, this is a mouse, this is a very small animal, and you can imagine that this is the brain of a mouse, and this is 10 cents. I mean, that's a tiny little thing. And so how do we image that? So there's a company in Winnipeg that we asked and recruited to build for us a SPECT scan specifically for a mouse, and this was purpose built for us, a SPECT scan, and for the mouse. And then we also have through Biotic, we have this CT scanner, and we have an MRI scanner for a little mouse, right? And so that was the next step, from human being back to the lab, and hopefully back to the human. So the question is, these molecules that we make, are they able to distinguish a normal brain from Alzheimer's brain? So this is the first paper that we published a few years ago. And here is a normal mouse brain, and we have injected the molecule that we have made that targets BCHE. And this is the Alzheimer model. And you can see quite clearly that this molecule is being taken up by BCHE because it is found in higher levels in Alzheimer's disease than in normal. And so then we ask the question, now this is just a static image, right? Can we have a dynamic image, right? So this is, hopefully this will work. I'm going to try something. I may lose you, but don't panic. This is actually a video which I'm very proud of, but I may not be able to show you. Oh, there you go. Look at that. There is a God. So can you, I assume you can see that. So we have injected this molecule in the model. This is the front part. this is the brain, and you can see that the molecule went to the brain and it got washed out, right? It has to wash out, and that it accumulates. It just goes and targets whatever is there in the brain. So I'm just going to show it to you one more time. Okay. So now we are working on these molecules to, once you have this is how things work in drug discovery, right? You discover a molecule, you say, yeah, that's good. Now you have to make this molecule a little bit better so it gives better images, and it's better images that we can make more definitive diagnosis. So what we have done, what I've gone through is the importance, using Alzheimer's disease as an example, the importance of examining brains, the importance of doing research if we want to find something, a cure for Alzheimer's disease and other dementias, the importance of brain banking, and how lucky we have been in Nova Scotia, in Halifax, that we have been able to do this. And we get brain tissues from all the Maritime provinces, but not only that, we get them from across the country. So somebody in BC, in Vancouver, heard about our brain bank, and they want to brain to come over here, right? So this has happened, Moose Jaw, or whatever. So there have been a lot of places. So we've been very lucky in this regard. And I use an example from my own lab about how the importance of finding a new target. You have to look at the brain tissues to find new target in order to find better ways to diagnose and treat Alzheimer's disease. And so when you do work like this, there are a lot of people that we need to acknowledge, including Alzheimer's Society and Dalhousie Medical Research Foundation, and many other foundations that have helped us go through our journey of establishing the brain bank, but also doing our own research. So I'll leave it at that. It's 2:05, and I will actually try to open my iPad so I can see you and you can see me.
So thank you very much, Dr. Jarvish. And while you're doing that, I'm going to encourage people to use the chat button to post any questions that you have.
I'm going to try to.
And thank you for taking us through that example with BCHE, making a very complex process into something that we can all get a glimpse into understanding and seeing the benefit of research, and the hope that more research will lead to a cause and cure eventually.
Yes.
So we're going to just look at some questions.
I'm going to turn off this.
Great. So we have a little technical difficulty today, but we have it under control. So can you hear me?
Yes.
Okay. So one of the questions is, you talked about it requires an autopsy. So is there a process in place, like, to get the autopsy first? What do families need to do if they want to make a brain?
Yeah. So autopsy is a standard thing at the hospital, right? Mm-hmm. So autopsy is a medical issue. We can't accept any brain tissue that has not been examined by the pathologist, right? And so the autopsy is a routine process that happens at the hospital. And there are autopsy consent forms, right? So your family doctor or the consultant can get the autopsy form for whatever hospital it may be, right? For here, it would be, Nova Scotia Health Authority. It could be for Cape Breton, it may be for their authority, right? And that autopsy form is filled out to give consent that at the time of death, we would like to have the brain examined. And then they can say in the consent form, if they wish, and donation to the Maritime Brain Tissue Bank. And when that happens, that's important, right? That's very important, because if that's not written, then the neuropathologist cannot send us the brain, because the neuropathologist needs consent to do the autopsy and consent to send the brain tissue to the brain bank. because then you're
Right.
telling the pathologist, we want both autopsy and research, right? And people have been very good to us, right? They see that and they'll send it, wherever it may be. So this is a very important issue. The process starts with an autopsy, which is a medical issue.
Right.
So the medical issue, just like anything else, you go to have an operation or whatever it is, you have to sign a consent form, right? So this is a consent form for autopsy, right? So it's signed usually by if the person is usually next of kin or whoever it is, substitute decision maker will sign that usually.
So if I said, if left in my will, that I want to donate my body to research or to Dalhousie University, I need to go beyond that, correct?
Yeah. So actually, the process is fortunately, after so many years, that process is easier. So donation of the body to the body donation program is a DOW, right?
Right.
And so if you say in your will that I want to donate, then there are forms to be filled out, right? And I want to donate for donation to the university, right? And you say, I want to donate my body to Dalhousie University for teaching and research, right? And you say, but I want my brain to go to the brain bank.
Right.
No problem. They'll send the brain to us because that person has said so, right? And so what we have to do, as I said earlier on, we need to get an autopsy done for that brain. So we will request half of the brain to go. That's what happens, right? Half of the brain goes for autopsy and the other half for research, right? So if a brain comes into the body donation program, no problem. We will do that, and we'll get the autopsy done through that process.
Great. And the good news is that the protocol for the steps that families have to take is both on the Alzheimer website and the Maritime Brain Bank website. So you can download the protocol and follow step by step, and call us if you have questions.
Oh yeah. And there's your number for Alzheimer's Society is there, and the number for the brain bank is there, and the website is there.
Good. So this is a question from one of our viewers. Do they know what causes BCHE in the brain? And are they closer to developing something to stop it from developing in the brain?
Right. So this is an interesting question, because if you look at the amyloid, which is also abnormal, there are a lot of things that are present in the brain under normal conditions. So BCHE is found in normal brain under normal conditions. But for some reason, just like amyloid, something triggers for it to accumulate. And under abnormal conditions, that's why we see that. Just like amyloid and tau, we are not sure what triggers that. We are looking into that, right? But we, and there are about 5 or 6 other groups around the world, are looking at using this BCHE as a target for diagnosis, but they are also a target for treatment. And so people are working on that as a target for both us too. A target is that for diagnosis and for treatment.
Great. Does the autopsy consent form mention the brain bank, or is that something the family needs to know about?
The family needs to know about that, and the doctors need to be made aware who is going to take the consent, and that has to be written by hand, and the Maritime Brain Tissue Bank. I am hoping, there was people are good wills, but a lot of things take a lot of time, right?
Yeah.
And I was hoping that, in the hospital autopsy consent form, there would be a brain donation part, and the discussion has been had. But I'm a simple guy, right? This hospital is a big machine, and so it hasn't happened. It's been a few years, but I'm hoping that someday it will happen so that we don't have to do that. But right now, if people are aware and we write things down, it's great.
So the main point there is on the autopsy consent form to write down donation being made to the Maritime Brain Tissue Bank.
Absolutely.
Yeah.
Absolutely.
Okay. How many brain banks are there in Canada?
There are about 4 that I'm aware of.
Okay.
There's one in Montreal. There's one in Calgary, one in Vancouver, and us. There may be other small ones that I'm not aware of, but these are the big ones, right?
And I heard you say you will accept brains from anywhere in Canada? And they have to go
So
through their provincial.
So there are things, right? Because we get financial support from you guys, right? Alzheimer's Society, and it's not like a huge amount, right? So we can't, pay for transportation of the body and all that kind of stuff. But if they make arrangements, and as I said, if they make arrangements for an autopsy to be done, they have to do an autopsy locally anyway, right?
Mm-hmm.
And then they can call us, and we'll tell them how to send their brains to us. So, but that autopsy has to be done in following the local guidelines. We can accept the brains, right? But we cannot, we have no influence on what happens locally, right? So whatever local guidelines are, that must be followed, right? Because whenever you interfere with normal process, nothing will work. So they have to follow, so this, I was in, the neuropathologist from Vancouver called me up. He says, this family want to donate. I'm happy to take out the brain and examine the brain, and we'll send you the other half. How about that? I said, isn't that wonderful, right?
Okay. So someone asks, are the autopsies done automatically for someone who has an Alzheimer's diagnosis?
No. Let me tell you, this is the other issue that is happening around here. There is no automatic anything.
Okay.
You have to request.
Okay.
You have to know what you want. You have to be upfront, right? You have to be proactive. There is nothing automatic. And let me tell you, one of the problems that we have in Canada, in Halifax, in Canada, and around the world, the autopsy rate for anything is less than 10%. That is a problem.
Mm-hmm.
I have no idea why that is so. But the rate of autopsies have gone down over the years for reasons that are, as I say, I don't know. I'm not an administrator. I'm not a manager. I don't know. But decisions are made, high and above, right? So, nothing is automatic, and you have to request that.
So when would be the best time to start having that discussion about brain autopsy or donating your body or?
Oh, there's, anytime that you are comfortable to initiate the discussion with your healthcare providers, as soon as you are comfortable that is what needs to be done. Just because the discussion is taking place doesn't mean that the death is imminent, right? It's just a discussion, right? And I think that, the importantly is when not to do. It's not when to do, when not to do. The day before, on the day, the time that somebody is passed on, and you say, oh my God, what do I do now? That is not the time to do that.
So it's part of that future planning, to think about what you want. If you're passionate about doing this, talk to your family members. So one of the questions was, what happens if my family member wants to donate, but I'm not sure about that? If somebody writes it in their advanced care directives, does it get carried through?
Well, that depends, right? I mean, I'm not a lawyer. I don't know.
So the basic thing is, if you're passionate about donating your brain, you should talk to families. You should let them know why. Get people comfortable with it. Do the planning ahead. Cross the T's. Dot the I's. And don't expect it's going to happen. It has to be you to take or your family member to take the steps.
Absolutely.
So one question here is a full autopsy required?
No, nothing is required.
Okay.
So in the autopsy consent form, it says full autopsy or it says brain only.
Okay.
So, it depends on what exactly you wish to happen, right?
Right. So thank you for presenting today. I think you've given us a lot to think about, and your example will, I'm sure, inspire lots of people to make brain donations, because we see all the good work that you're doing, and we're really so fortunate to have you here in Halifax and serving the Maritimes and the rest of Canada. So thank you for that. If people want to stay on the line and type in questions, I'm sure we can send them out to you if you're interested in further questions or further information about how to make a response. This also is being recorded and will be on our website. So if family members want that discussion, they could sit down, watch it again, have a discussion. Sometimes conversations about brain autopsy or brain donations are difficult, but if you've got something like a video to watch first and then have the discussion afterwards can be a really good starting off point.
Yeah, you can also, if you have specific question, chat and all that kind of stuff is fine. But there is on the website, there is the brain bank phone number. And you can call that. Everybody's working from home right now because everything is shut down at the university, but we are all answering phone calls. So, you can make a call and in 30 seconds, you'll get your answers.
Okay, so we encourage people to call the
Yes,
Maritime Brain Tissue Bank if you have questions.
Yeah, absolutely.
So thank you very much. There will be a poll going up on the screen in just a minute. We're asking you to please respond to that. Thank you for tuning in today. Any comments or suggestions about future topics, please call 1-800-611-6345. If you'd like to have a confidential call with any of our InfoLine staff to talk about anything you've heard today or any other questions you have about dementia, please call. We remind you that this will be recorded and on our YouTube channel. And thank you, everybody, and be safe. Tune in next week where we'll be talking about InfoLine and your journey with InfoLine. So thank you very much. We'll leave the Zoom platform open for a few minutes so you can connect with the poll or post any questions. So thank you. Thank you very much, Dr. Darvish.
Thank you. Yeah, I'm going to sign off.
Okay, bye-bye.
Bye.